Hello everybody and welcome back. This is Dr. Mridula V. Amarnath here. So like we all know, pregnancy is one beautiful journey. But during the journey, there are a lot of changes that take place in our body, right? And one such change that most pregnant women notice is a change in their teeth as well as in their gum. So today, I'm going to talk to you about the various most common problems that we face in our teeth as well as in our gum. So stay tuned to know more. So the first and the most common problem is gingivitis. That is what we call as the infection of the gum. Now this is most commonly seen during the second trimester. Now the symptoms include swelling of the gums, bleeding, mostly seen during brushing and while flossing between the teeth. Now, most of these gum problems which are caused during these pregnancy hormones, they generally tend to resolve after birth. While for some women, they develop a deeper level of gum disease that will require treatment even after pregnancy. Now, if your gums bleed, do not stop brushing your teeth. Instead, use a soft-headed toothbrush and a fluoride toothpaste and brush at least twice a day. The second thing is we also know that during pregnancy, most women have this morning sickness. So they tend to have these repeated episodes of vomiting or regurgitation of food. So when this happens, for quite some time over and over again, what happens is the strong acid content that happens during this regurgitation or during vomiting, it slowly starts covering your teeth. Okay, and when it starts covering your teeth over a long period of time, it slowly starts damaging your teeth and eventually causes a tooth decay. So some of the simple tips that you could try in order to protect your teeth from those strong acids are: 1. Avoid brushing your teeth immediately after vomiting. While the teeth are covered in stomach acids, the actions of brushing may scratch the tooth enamel. Make sure you rinse your mouth thoroughly with plain water. Follow up with a mouthwash containing fluoride. Now, in case if you do not have a fluoridated mouthwash, put a blob of toothpaste containing fluoride on your finger and smear it all over your teeth and rinse thoroughly with water after that. Make sure you wait for an hour after vomiting before you brush your teeth. Third thing, some pregnant women, already we have that nausea and that vomiting, sensation, everything. But along with that, some of them, when they brush their teeth, especially the back set of teeth, they have that, gagging reflex. But how do you get over it? You cannot stop brushing those back teeth, right? I mean, eventually, even if you don't do that, they would get decayed, right? So how do you do that? Make sure you use a toothbrush with a small soft head, such as brush which are made for toddlers. Take your time. Do not rush. Go slowly when you're brushing. Now, it may help to even close your eyes and concentrate on your breathing. Or probably, try distracting your mood and you could listen to some sort of a music so as to, distract yourself. Now, if the taste of the toothpaste causes you to gag, then make sure you switch to another brand. Now, we all know that, different women have different sort of cravings while they're pregnant. But a lot of them have cravings for sweet substances, right? But let me tell you, personally, it is important that you try and restrict yourself from having these sweet substances. Because, eventually it can, because your teeth is already very sensitive during this phase. So, you do not want to damage your teeth further on, right? So make sure you try and restrict as much as possible. But even after that, if you cannot, then try to switch on to something which is more healthier, like probably fresh fruits that could, try and satiate your sugar cravings. Next thing is make sure you always increase your calcium content. Now this is extremely essential for the mother because the bones, everything is quite fragile and delicate. So for the bones as well as for your teeth, and it is equally important for your developing baby. So make sure the calcium content is, increased during your pregnancy levels. Now even vitamin D during this journey of pregnancy is extremely important. You must be wondering why vitamin D? Because vitamin D helps the body to absorb calcium. So let me conclude by giving you a small take-home message. So like I said, during pregnancy, every part of our body is undergoing a lot of changes. So, every part of our body is extremely sensitive and very delicate during this phase. And our teeth is same. There is no change in that. Even our teeth, our gums are extremely delicate and sensitive. So, you should take that extra care and that extra effort, because if you do not during this phase, then probably after your pregnancy, you will face a lot of complications. You will have a lot of bleeding, swelling of your gums, and, tooth decay, and which can be a lot of pain. So why unnecessarily go for it, right? When you can just follow these simple tips and take care of your teeth. I mean, that is like, one big burden reduced. Okay? So make sure you take care of your teeth, which is equally important during pregnancy. Okay? Stay safe and stay happy. Thank you.